Good evening and welcome to 60 Minutes. Every 10 minutes in Australia, somebody suffers a stroke. It's our second biggest killer and has left nearly 500,000 survivors living with crippling disability. But despite the dramatic medical advances in other fields, there's only so much that can be done for a stroke patient, which makes the work of one clinic in America so tantalising. Its results have to be seen to be believed. The therapy is controversial and heavily criticised, but the patients say it's truly miraculous.
Can you please count from 1 to 10?
Every minute of Linda Lumbra's daily life is a frustrating struggle.
One, two.
She suffered a stroke 3 years ago, which left this teacher barely able to walk or talk.
4, 5.
Doctors have told her this is how she'll be forever. That's why Linda's travelled to this Florida clinic to try a controversial new stroke treatment.
Well, I can understand why you would. The speech makes it very frustrating.
It's her last shot. One injection of a drug called etanercept into her spinal cord at the back of the neck.
What's different?
A brief few minutes pass to let the drug flow to her brain.
Clear.
Clear. Okay.
And not even Linda or the doctors here expect what happens next.
Okay, did it look cloudy? Okay, now it's clear.
Oh my.
It was a bullseye hit on the pathology that was interfering with her brain function.
Yeah, you're doing fine. You're doing super fine.
Using etanercept in this way on stroke patients is groundbreaking.
So crisp.
1, 2.
The conventional and approved use of etanercept is for the treatment of severe arthritis.
Can you bring it up?
But Dr. Ed Tobernick has 700 stroke patients who've received this treatment at his Florida clinic.
Little stick.
An anti-inflammatory, it attacks or blocks the build-up in the brain of a molecule called TNF, or tumour necrosis factor.
In stroke, what happens is there's an inflammatory response, a chronic inflammatory response that is caused by the stroke. Etanercept works by neutralizing that chemical, TNF, thereby improving the ability of brain areas to communicate with each other.
Hi, Charlie. Nice to see you. I'm going to give you a few words to repeat.
We featured Dr. Tobernick on 60 Minutes in 2011.
And can you tell me who is the U.S. president?
When he used the same drug, injected the same way, on Alzheimer's patients.
Charlie, who is the president of the United States?
Obama.
Yes.
Dr. Tobernick now claims his unorthodox treatment can aid stroke recovery.
Okay, you'll feel a little stick just for a second.
We see improvements in cognition. We see improvements in motor function. We see improvements in spasticity. We see improvements in pain.
617 stroke pieces.
It's those improvements that 52-year-old Linda Lumbra and husband Benny have been searching for. How would you describe your wife before this happened?
Oh, very outgoing, people person. Loved to chat with people and visit and, you know, help people also.
Linda collapsed while teaching in her classroom in late 2010. It was a massive stroke following an epileptic seizure. She lost virtually all speech, and Linda's left side fell limp and numb.
Touch your nose.
Traditional stroke therapy could only do so much. And after 6 months in rehabilitation, Linda was sent home. This must have been heartbreaking, watching your wife become this person.
When she first came home, she couldn't even do stairs. It was a struggle to do bathing. Couldn't prepare meals. She had a very difficult time. And she always was very independent, and it was hard.
So to see her become the complete opposite of that must have been terrible for you.
Well, it was like a shock almost. You know, you thought, you know, she's going to get better, progressively better, and as time goes on, and yeah, a little bit, but not really what I thought as time went on. So I was like, well, maybe this is the way it's going to be, and we need to learn how to deal with this.
Well, she'd get frustrated.
Linda's twin daughters, Christy and Casey, struggled to accept there was not much more that could be done for Linda.
It's hard. My mother was a teacher. That's who she was. And I think it's hard to watch your mother not know who she is anymore. Because she was a mom and she was a teacher. And then when that's gone,
She became a different person.
Yeah, she's trying to find her place.
Okay, now you want to take this by hand or put it in the bag?
No, I'm taking it on board with me.
Like Linda, Antoinette Papa from Brisbane knows the pain and suffering of stroke.
You right there, baby?
Yeah.
With husband Carlo, she's making the long journey to America for an appointment with Dr. Tobinick. For 12 years, she's lived with paralysis and constant pain. And she's been searching for any treatment that may help. Now, she's willing to try the etanercept spinal injection. What are you hoping it will do for you?
We have talked about it a lot. We'd be happy between 5 and 10% improvement.
For me, if I could get rid of some of this tightness in my arm, that would make a huge difference. Because it's not just sort of makes things difficult, but it's also quite painful. Having the stretches is very painful, so it's not a pleasant thing, and it's a very hard condition to treat with anything else.
So if you could get a very slight improvement in the least,
I'd be very, very happy, yeah.
Turn your head to the left.
the etanercept injection will not reverse paralysis in stroke patients like Antoinette.
Can you squeeze?
But Dr. Tobinick believes it can decrease severe muscle spasticity and ease post-stroke pain.
Go ahead.
One of the most crippling effects of stroke for which there's little treatment.
No.
The shoulder pain, is that something you have every day?
Yeah, just about every day, yeah.
But if I try to move your wrist up, is that uncomfortable?
Yes, it is, yeah.
Just a little motion is uncomfortable, okay.
It's really tight.
Antoinette is also somewhat of a guinea pig. She'll be the clinic's first stroke patient to undergo a sophisticated 3D brain scan following the injection
All done?
to see how blood flow and activity are affected or improved by the drug. Coming up, Antoinette's amazing results
That's quite spectacular.
and the incredible moment
Hi!
Hello there!
Linda wakes up.
Woohoo! It worked!
Welcome back to 60 Minutes and the extraordinary new stroke therapy transforming lives. When Linda Lumborough suffered a stroke 3 years ago, she lost her speech and struggled to walk. And like so many stroke victims, rehabilitation could only do so much. But then she heard about a controversial injection that was reducing the effects of stroke. It isn't fully tested and is viewed cynically by many neurologists. But that hasn't stopped Linda, and the results are something to see.
What's different?
It's only been a brief few minutes since Linda Lumborough received that injection of etanercept at the base of her brain.
Clear.
Clear.
She's been tipped upside down to allow the medicine to flow into her brain.
Oh my.
Remember, this is stroke-affected Linda just before the injection.
1, 2. Oh my.
Moments after the shot, she sits up. The change in Linda is something to behold.
It's gone! Hi!
Hello there!
Woohoo! It worked! On me!
Yeah.
Oh,
here is clear.
Hi! It's me!
It's truly a miracle. It happens all so quickly, and it's done. And before you know it, it's all over with, and then boom.
I can talk. I can walk.
We felt it was likely that she would improve. To improve almost back to normal was just spectacular and wonderful and gratifying and very, very moving to watch.
Hi.
How would you describe yourself before and then after the injection?
It's just truly amazing. The change is absolutely miraculous. It's amazing. Every day there seems to be something that's like, oh, I can do that now. It's amazing.